So I'm supposed to tell you why I started BAC, but really you told me why to start BAC. Patients were saying to me that it was really difficult in order to find a place that they could go to as an outpatient, so that is not being admitted into hospital, have the latest treatment because nothing else was working that involved neurostimulation, and do it in such a way that they wouldn't have to massively affect their life, their work, their loved ones, because they had had such terrible experiences in the hospital system before that. And then add to that, I'd actually looked into neurostimulation. I'd qualified from the Black Dog Institute in 2014 in RTMS, and I loved the concept. I loved the technology, and I thought that there was a lot of usefulness in it coming from a neurosurgical background, not a neurosurgeon, but in doing neurosurgical training. To me, I think that neurostimulation is that next frontier. It's that missing link where we'd previously, treated the brain as a content box, and that was kind of like the Freudian, era. Talk therapy is really the kind of continuing practice of that. Then we treated the brain as like some sort of chemical box, which is the medication era. Not that that has passed, but it is as useful as people find it. And then we're really into now, with the advent of technologies looking into the brain, imaging it, being able to understand its electrical function. We're able, in order to understand the brain as an electrical, chemical, and content box. So there's these three kind of eras that are all coming together in this neurostimulation, neuromodulation era. And that's what makes it so exciting, that it's not just like, here's a hammer and everything's a nail. It's okay, so this is going to work in this dimension. So for example, there are ways of treating the brain and inducing neuroplasticity that has nothing to do with content or chemicals or even neurostimulation. It's exercise and diet, sleep, and all of that research tends to be pushed to the wayside. So I wanted to create a space that addressed those patients' needs. They're pretty functional. It's not that it's mild or moderate, but even if it's severe, there's a life that they have to go on with. There's kids, there's dogs, there's family, there's work. And we wanted to bring the latest technology for you to experience it here in Australia, not to have to go to LA or to Europe, etc., in order to receive it. Bring all of that into Australia in a research grade clinic, so that we are able, in order to practice good clinical practice standards, just such that you would essentially receive it as if you were in a clinical trial. And it's super important to us to make sure that we would use the standards that we would use on our own head. So we're not just going to use RTMS, we're going to use neuro-navigated RTMS, we're going to use anatomical localization. And when it becomes more prevalent and becomes more understood, definitely for certain conditions where we know that the cortical map changes, like Parkinson's, look to use functional MRI or some sort of EEG mapping. And I think that's critically important. That reflects our latest understanding of what the research is. So that's why we started BAC, because we wanted what would essentially be a world-class clinical grade brain treatment center here to help modulate the brain, treat conditions not just like depression and anxiety, which are so common, but Alzheimer's and autism and ADHD and Parkinson's, and conditions where they're on the rise. There really isn't much that can be done, as much as because we don't understand the etiology, as much as we actually don't have medications or content therapy that actually treats the symptomatology, that maybe electrostimulation, neurostimulation, neuromodulation can actually be that frontier.